Do you know most women nowadays are dying of cancers? And more specifically breast cancers. These are one of the most common type of cancers. You find them everywhere nowadays in women. And so it's very important to know about breast cancer. Can you tell if you have breast cancer or not? First of all, what is breast cancer? Breast cancer simply means some abnormal cells that grow on your breast, and they can easily spread to other parts of the body, and they cause you to have disease. And you know what? Cancer cells are called stubborn cells because they don't obey. They don't obey to your body like your normal cells. So it's very important to identify these abnormal cells or stubborn cells very early and manage them. But the good news is this: early detection leads to very good outcomes. It means if you detect cancer very early, you are going to manage it very well. So stay put and don't fear. So how do you know you have cancer? What are the signs of cancer? What are those things that you can suspect if you have cancer? Number one, a lump on your breast or on your armpit. So I would advise women to regularly palpate or touch your breast. You know what? Your husband can help you too. They can palpate and touch your breast. If they touch it or you touch it yourself and you feel a lump on your breast, you need to see your doctor. Something might be happening wrong. The next thing is discharges from your nipple. If you notice a discharge on your nipple, either milky or bloody, it's a red sign. You need to see your doctor. Those are some signs of breast cancer. And equally, a change in the shape or the size. Imagine your breast was like an apple. Imagine it was like an orange. And then suddenly it becomes like a watermelon. Something is wrong. You have to check what is happening. Sometimes the color of the breast even changes. It looks like the back of an orange. In French, we call it peau d'orange. So if you notice these changes, you should see your doctor. Something wrong might be happening. These abnormal cells may have just started doing their work and we need to arrest them. And now, what are the risk factors? What are those things that can make you have cancer easily? Listen very well. You have to avoid these things because if you avoid them, your chances of having cancer will also reduce. Number one, excessive alcohol and cigarette consumption. You know, in our generation now, we like smoking, we like drinking alcohol excessively. But you know what? It may just be the cause of your cancer. So if you are smoking excessively, if you are drinking too much alcohol, you are at high chances or high risk of having breast cancer. The next thing is family history. You know what? If your mom had cancer of the breast, if your auntie had cancer of the breast, you have higher chances of also having cancer of the breast. So a family history of cancer of the breast can predispose or can expose you of having cancer. The next thing is too much weight. You know, a lot of people are chubby. They eat and eat and eat. You know, you eat shawarma, you eat everything. And so as you are gaining weight, you are also gaining those abnormal cells that can cause cancer. So avoid excessive weight because it's a risk factor for breast cancer. And finally, sedentary life. Sedentary life means what? A lazy life. You want to go to a little distance and you are looking for a taxi, you are looking for a bike. So because you are inactive, there is too much accumulation of fat in your body, and what it leads or it predisposes to having cancer. It exposes you more of having cancer than somebody that is swift and slim. So avoid gaining excessive weight. Now, how do we manage cancer? Good to know. If you notice it very early, you can handle it. So how do we handle breast cancer?